Representatives from all over Africa has gathered in Sahara city of Dakhla, Morocco, for a groundbreaking initiative focused on improving healthcare across the African landscape. The event, organized by the Mohammed VI Foundation for Science and Health, emphasizes South-South cooperation for health sovereignty, a significant concept that advocates for Africa to create its own solution to healthcare challenges rather than relying on foreign assistance.
This journey is for the cooperation South-South in order to show that there are so many leaders in the health sciences in Africa, so we can together build a new health system for Africa in terms of training for people, for young researchers, but also in terms of vaccine sovereignty, in terms of competence and capability for Africa by Africans.
How important is this particular academy for Africa?
This academy is from Dakhla is to show that we can bring together our strength, our capability, men and women from Africa. We have so many scientists from Africa, men and women in health sciences. So if we bring together our competency, our ability, we can train the future generation and show that we can be able to build a new health for African people by African people.
Challenges that the African continent is facing as far as health is concerned, you can mention a few of them.
Yeah, the challenges are not in terms of human capability. We have scientists. The challenges are mainly economic challenges. It is why it's very important to put together our capability, our wellness, and our financial also capability. So this is the main challenge. But if we work together, there will not be challenge too anymore.
So far, how has other countries, agreed to come? What is the synergy like?
Yeah, in fact, there are so many synergy. There is a capability in Morocco from here, but there are so many capability in African countries. There is so many huge and big scientists in Africa. They work in Europe, they work in North America, they work in Australia. So if we bring them together here in Dakhla, we can show to all the world our capability and then to build a better health for African people.
At the heart of this initiative is the African Academy of Health Sciences, a new institution that will be built by Africans for Africans. This academy aims to educate healthcare workers, support research and innovation, and develop solutions that are uniquely tailored to Africans' diverse needs. The Academy's key focus area will include developing vaccines, raising awareness about prevalent health issues, and sharing crucial health data across the continent. African leaders and experts are optimistic about this project, viewing it as a vital opportunity for Africa to take charge of its healthcare future. The continent faces numerous challenges, such as shortage of doctors, nurses, and healthcare facilities, alongside a burden of diseases and weak healthcare systems. There is a growing consensus that Africa must develop its own solution, grounded in its unique cultural and regional context, rather than depending on outside help. The African Academy of Health Sciences is regarded as a positive step in this direction. By bringing together professionals from across the continent, it would foster the exchange of ideas, promote collaboration on health-related projects, and help address critical gaps such as a shortage of healthcare professionals, vaccines, and healthcare infrastructure. During the meeting in Dakhla, African leaders emphasized the importance of cooperation in tackling the continent's health challenges. Amini Tarawi, Morocco's Minister of Health, stressed that solutions should be adapted to Africans' realities and highlighted the value of pooling knowledge and resources for mutual benefits.
savons que les défis sont nombreux, l'inégalité d'accès aux soins, les pressions liées aux maladies émergentes, l'impact du changement climatique, mais nous sommes convaincus que cette académie sera un outil puissant pour relever ces défis. Par son approche holistique et sa pédagogie innovante, elle permettra de transformer les obstacles en opportunités en plaçant l'humain au centre de toutes les initiatives. Nous sommes convaincus que la complémentarité de l'Académie africaine des sciences et de la santé avec les autres centres de formation, de recherche et de développement, qu'ils soient au Maroc ou en Afrique, sera un atout majeur qui favorisera l'émergence d'un écosystème performant tout à fait cohérent avec les aspirations du continent dans son ensemble. Nous sommes enfin convaincus que les avancées technologiques majeures dans l'intelligence artificielle, la robotique et les outils de médecine personnalisée offrent de réelles opportunités de transition vers une médecine plus inclusive, plus adaptée à nos contraintes et plus durable. En ceci, l'Académie jouera un rôle fondamental d'incubateur de ces technologies, mais en même temps de pôle d'agrégation et de maîtrise de l'ensemble des innovations du secteur médical.
Several former leaders, including Olivia Ruhamba of Burkina Faso and Yakumba Kasama of the Gambia, also expressed their support for the initiative. They discussed the financial and human resource challenges facing Africa, such as the insufficient funding for healthcare and the brain drain of doctors to other countries. Their insights reinforce the need for Africa to build its own healthcare system and retain a skilled workforce.
It to be sized because it gives room to African health experts to meet and to share experience, and also it gives opportunity for training for African students. You know, as for Burkina Faso, we used to bring our patients here, sick people, for treatment, and having this kind of African academy, to me it will make things easier, because through the sharing of experience, we can also have our own experts in some field. In some disease, so that it can even reduce the evacuation fees. And beyond that, it's a big signal to show to the rest of the world that Africa is starting to really be unite on the health side, and that is really of paramount importance. So being here, following the sharing of experience, even the launch of this institute, for me is really a great step that Africa is making. And we really need to keep focus on this kind of initiatives, because the secret of our development will come from this kind of initiative, if I may say so.
Dakhla, as you know, is southern Morocco, where the King Mohammed VI have a foundation, and he established an institution, an academy here in Dakhla. And this academy consists of research institution, hospital for services, and teaching training of medical staff. And this is an idea whereby they want to make sure research is inculcated in health services so that we can always go forward. Now, apparently this is not the only place that this type of institution is built in Morocco. According to the Minister of Health, you were all there when he presented, this type of thing is happening in many areas of Morocco, where the king has built a research center with a teaching hospital attached to it, an academy attached to it, and all these things going on concurrently. And all this is to encourage more ownership in the healthcare delivery, to create good leaders in the healthcare delivery, to make sure also there is also sovereignty so that Africans can own their healthcare delivery. Basically, all these things is done in Morocco, and we are called here, I think all African countries are present here, to make sure that we cooperate, there is South-South cooperation. Instead of just emphasizing on South-North cooperation, which we have all been doing for centuries, and here where we are. So we believe, Morocco believes that it is high time we cooperate, South-South, Africans cooperate and develop ourselves, and we get our own sovereignty and really focus on our own research and target on our own conditions to make sure we forge ahead. I think it's a very good opportunity, and it's a very good chance for all countries to come so that we sit together and we learn from each other and we move on.
Language Simenal, a participant from Gabon, pointed out that the health of one African country is intrinsically linked to the health of its neighbors. This intercontinentedness underlines the necessity for all African nations to collaborate and support each other in health matters.
We are here to, after invitation of the organizer of this manifestation, who promote study and cooperation with doctor, with everybody who practical health science, and we approve, my organization approve this initiative, because this initiative will permit to many African countries, many African people to receive good healthcare, to receive good formation, good study. And you know, many people in Africa don't have money to go another country to have good healthcare, you see. But with this initiative, we think that many of our brother or sister can come to this or to be in her country, and with internet receive experience of another professor, another practical healthcare, and help. Excuse me. I think that is opportunity of us, because our country don't have money, resource to have this center, you see. But this country take a decision to have this center and to associate every African. Is very good for us, and is better good for young, for women, and for next generation, you see, because with the time we think that he can do this center in East region for Africa, Central Africa, South Africa, you see, but is the reason.
As the events come to a close, the key message was clear that Africa must take control of its healthcare future. The establishment of the African Academy of Health Sciences is a significant first step, but it will require continued commitment and efforts from all African leaders to ensure its success. This initiative represents not just a healthcare project, it signifies Africans' determination to control its future and build a sustainable healthcare system that works for everyone. The historic event in Dakhla marked an important moment in Africans' healthcare journey. It's demonstrated that through cooperation, Africa can create a healthier, more resilient future for all its people. From Dakhla, Morocco, I am Sandra Agboso, WTV reporting.